Hello, I'm Dr. Michael Dansinger. I created Diabetes Reversal Partners because our healthcare system is in severe crisis, and I'm eager to do something important and unique to help improve things. I'm fed up with the worsening disconnect between patients and healthcare providers. I'm fed up with the inefficiencies that get in the way of good quality relationships between doctors and patients. I'm fed up with the lack of disease prevention and reversal that's dragging down America's productivity and economy. The better we as a nation become at disease prevention and reversal, the stronger America will become. If we think about America as the patient, there's no denying that it's sick. Preventable heart disease remains the leading killer of men and women, and after a half century of progress, it's rising again due to worsening obesity and diabetes rates. Diabetes is one of the nastiest diseases we treat. It triples the risk of premature heart disease and stroke. It's the leading cause of blindness, kidney dialysis, and foot amputation. It puts a huge financial burden on individuals and the economy. Shockingly, over 50% of adult Americans have diabetes or prediabetes. In those over 65 years old, about 80% have type 2 diabetes or prediabetes, and most of that is preventable or reversible. Type 2 diabetes is due to a chronically strained pancreas with progressive loss of insulin production over time. The proven way to reverse it is by taking the strain off, which includes losing weight and improving dietary intake, allowing the overworked pancreas to recover and heal as much as possible. Most patients with type 2 diabetes have the potential to reach what I call a remission weight with near normal blood sugar, even without diabetes medication. This weight is typically about 30 to 35 pounds, or about 15% below their current weight. When patients learn they have the potential to achieve remission, then they become even more motivated to follow our program. A calorie reduction of about 20% is typically enough to achieve that degree of weight loss. There are many good eating strategies that can get the job done, but patients need coaching and intensive lifestyle support to overcome all the challenges that interfere with long term success. Historically, patients who've stuck with me beyond 3 months have had an average weight loss of 10%, typically over 4 months. Many patients have lost 15% or more of their body weight beyond a year. The average reduction in hemoglobin A1C has been 1.5 points, for example, from 7.8% to 6.3%. Over 2 years of follow up, program participants have sustained a 1.5% A1C reduction on average compared to non participants. Most importantly, one-third of my patients with type 2 diabetes who stayed with me beyond 3 months have achieved an A1C of 6.0% or less with no diabetes medication. Of these patients who achieved diabetes remission, 80% of them remained in remission with A1C below 6.5% after 2 years. I'm surprised more doctors don't do this important work. It's really gratifying, and patients love the special attention and close relationships that grow over time. This work has made me into the doctor I've always wanted to be, and I'm eager to train a team of other healthcare providers to help bring the benefits to patients across America. We make it as convenient and affordable as possible, and that's why we see patients by video and bill visits to Medicare and many other insurance plans. Everybody wins when type 2 diabetes is reversed and prevented. Patients love it, and so do the healthcare providers who refer patients. Everybody saves money too. Research studies show that insurance companies and the healthcare system in general save money because it reduces the need for expensive diabetes medications, including insulin, and reduces the risk of future hospitalizations. Patients save money for the same reasons, and families, employers, and society benefit in all sorts of ways. If we can help prevent diabetes complications like vision loss, kidney failure, foot amputations, heart attacks, strokes, and dementia, then all the better. There's no downside. For all these reasons, I'm proud to have created Diabetes Reversal Partners. If you're a healthcare provider interested in referring patients or a patient yourself, then please provide your contact info on our website so we can partner with you. We also invite you to tell others about us and help spread the word about what we're all about. I'm Michael Dansinger, MD, and I thank you for your interest.